I spend a lot of time outdoors, hiking, biking, playing golf, sometimes in the rough. I know about wearing long pants, spraying DEET insect repellent, and checking for ticks, but somehow at least one of the little buggers bit me. So for the past few weeks, maybe a month or two, I've had a dull headache on and off. I've been really tired, and I've also been stiff with achy joints. Putting all of those symptoms together, I started to suspect Lyme, so I asked my doctor for a blood test this week, and less than 24 hours later...
There's a Western blot test and an ELISA test. In your situation, the ELISA was grossly positive and abnormal, but the Western blot was equivocal. And it becomes very important to combine your clinical symptoms, how you feel, with these blood tests in order to make the diagnosis.
Right away, I started on the standard antibiotic treatment, doxycycline, for 14 to 21 days.
The studies generally show that 90% of patients do very well with that, and maybe 10% 6 months later are still struggling with some symptoms. It takes a while for the full benefits to be seen.
Now, Dr. Fallon also said that the sooner you start antibiotics, the more effective they are. But that's a problem. Unless you see a tick bite or a rash, you may not suspect Lyme and might go undiagnosed for a long time because the symptoms are a lot like the flu or a bad cold.
So did you see a tick or a bite or that bullseye they talk about?
No bullseye rash, no tick bite. I never found a tick or anything. But many people never see a tick, and as many as half of all Lyme patients either never get a rash, bullseye or otherwise, or get it in a spot and they don't see. That's why Dr. Fallon says if you spend any time outdoors and have those symptoms of fatigue and achiness, get a blood test.
Yeah.
Right.
Get checked.
Be safe. Thank you, Dr. Max.
All right.
Hope you feel better.
Yeah, really.
I'm good.
Okay.